Hi, this is Dr. Dumitrescu, and this is a little tutorial on how to reconstitute your Beta HCG or Pregnyl solution for injection. The package is going to have two vials. One of them is going to have a liquid in it. It's usually normal saline or sterile water. The other vial is going to have a powder, which is the actual Beta HCG or Pregnyl. The first step, you're going to need some alcohol pads. You're going to need a 10 cc syringe. You're going to need an 18 gauge needle to draw the normal saline. And then in order to inject the actual Beta HCG or Pregnyl into your subcutaneous belly, you're going to need a 1 cc tuberculin syringe and a small 30 gauge needle. First step is to use one of the alcohol pads and wipe the top of the two vials thoroughly. Second, you will have to open the 10 cc syringe and open the 18 gauge needle and attach the 18 gauge needle to the 10 cc syringe by rotating it very tight. Then we take the cap off the needle and we draw from the saline vial approximately 10 cc of solution. So the syringe is 10 cc, so it should be pretty easy. When you get to the 10 cc gradation, you will have approximately 10 cc of solution in the syringe. Now we have the 10 cc of fluid in the syringe. We will cap the 18 gauge needle back. So when you cap the needle, please be careful not to stick your fingers. So you will have the needle cap in place, cap the needle and twist it off. So you're just going to have a vial with powder, and you have to put the 10 cc of saline into the powder. So cap back the needle, open it, and stick the needle through the rubber stopper, and then you will inject the 10 cc of saline into the powder. Now when you do that, the pressure is going to increase inside the vial and you're going to feel resistance to the injection. When that happens, make sure that you draw some air out of the tube and then you inject again, and draw some air out of the tube and inject again until all your normal saline is injected into the tube. Again, very carefully cap back the tube, please don't stick your fingers, and then gently swish the Beta HCG with the normal saline. Now you're going to have a solution of Beta HCG, so you have 10,000 units of Beta HCG in 10 cc, so that means that you have 1,000 units per cc. The usual dose that we prescribe is 1,000 units, so 1,000 units is going to be 1 cc. Now very conveniently, you're going to receive a 1 cc syringe into the package. So this is called a tuberculin or 1 cc syringe. Now this syringe is going to be used to draw 1 cc from this vial and inject into the belly. So for that we're going to use the 30 gauge needle. So we open the 30 gauge needle, we attach it to the tuberculin syringe, and then we have the 30 gauge needle to draw from this vial. The vial is upside down. We put the needle through the rubber stopper and then we draw approximately 1 cc of medication into the tuberculin syringe. Now it may take a little while for the syringe to fill because this is a very small needle, so you may have to draw a couple of times and then make sure that all the air from the syringe is back into the saline vial. So you have to be a little more patient with this very small needle because it's just going to be a little bit longer to draw. So now we have a 1 cc of Beta HCG into the 1 cc syringe, and we have a 30 gauge needle. Usually at that point you can recap the needle, again very carefully not to stick your finger, and use another alcohol pad to clean the skin of your stomach where you're going to inject your medication. Clean the skin thoroughly. Use your non-dominant hand to pinch the skin, uncap the needle, and then inject through the skin straight into the skin until the needle hub is close to the skin, and very carefully inject your Pregnyl or Beta HCG under the skin. When you're done, take the needle out, cap it back, and please dispose the needles into a sharps container. Pharmacy usually will send you a sharps container upon request. If the pharmacy doesn't send you a sharps container, please dispose these needles, in some sort of a hard box or something, so people do not get, stuck with them when they collect the trash. Usually a sharps container is the best bet. If you don't have a sharps container, we'd be more than happy to provide you with one. And this is the tutorial for Beta HCG or Pregnyl. If you have any questions, please give us a call. Thank you.